Welcome to Local Edition. I'm Brad Pomerance. We're in the Inland Empire today, joined by Mark Takano, member of the U.S. Congress, representing significant portions of Riverside County. I'd like to start by talking about health care. The Republicans in Congress were able to pass what's known as the American Health Care Act. A lot of controversy surrounding it. One of the biggest deals with pre-existing conditions.
Yes.
Candidate Trump said on the stump that he would make sure that any Obamacare repeal would save pre-existing condition protections. It doesn't appear that the American Health Care Act does that. States can waive.
States can waive under Trumpcare, what I call Trumpcare.
Sure.
They can waive the requirement. There's 10 essential health benefits required under the Affordable Care Act, under Obamacare. And we can think of those essential health benefits as consumer protections.
Right.
That health insurance plans are extremely complicated. Insurance companies can really play upon those the complicated nature of these plans by making them confusing.
But what's confusing to me, just as a lay observer, is that the president was so clear that whatever happened, you had to have protection for pre-existing condition. And
Brad, not only did he promise this during the campaign, he also said it while he was president. That he was going to make that whatever he was going to replace Obamacare with was going to be better, cover more people, and be less expensive. And he reiterated that he was going to protect people with pre-existing conditions. But in fact, Trumpcare weakens those protections.
Well,
they substitute what they call these high-risk pools. Which have never worked. They've not worked to date.
In California, we had them.
We had them, and we had waiting lists. People with pre-existing conditions couldn't. They had to wait. They had to be on. Just like for affordable housing, they had to be in long lines to get even a policy. And when they got that policy, often the policies didn't cover.
In California, we had something called Mr. MIP. That's what they called it, Major Risk Medical Insurance Program. Only 7,000 were covered in the entire state. Like you said, long lines, ineffective.
When push comes to shove, it's the states just can't take on this by themselves. We need the force and the momentum of the nation behind all this to solve this problem.
What we also know is that after the House bill passed, the Congressional Budget Office, nonpartisan, came out and said that 23 million Americans would lose their coverage.
23 million over 10 years.
Right.
14 million in year one alone.
That's a lot. That's a lot to happen quickly.
Yes.
Very quickly, 14 million.
Well, and let's bring it home. Almost 100,000 people in my district alone.
Please.
100,000 people, 96,000 people have gotten newly covered under the Affordable Care Act. About 80% of that, 80,000 of it is expanded Medicaid.
And let's talk about the expanded Medicaid, because under Trumpcare, as you call it, federal funding to expand Medicaid, the expansion as we know it, is eliminated in 2020. California has been a big booster of the expansion, almost 4 million.
40% of Californians depend on expanded Medicaid for their health insurance. And it's important to remember, because Donald Trump and Mick Mulvaney, they're all trying to say this is all about Budget Director Mick Mulvaney, are trying to portray these people as deadbeats. 60% of Medicaid recipients work. They simply don't make enough money.
So let me ask you, what do you do as a member of Congress from California, which has 2 Democratic senators in the United States Senate? What can, because now it's in the United States Senate, they need 50 votes.
Well, what I want to tell people is their activism, their concern, their engagement. The voters were paying attention. We now, just a couple of weeks ago, the Trumpcare was at 17%. The latest poll by the Pew Charitable Trust shows that it's only 7%.
Want
to see the Senate pass what the House has passed. Mitch McConnell is even beginning to say that he's doubtful he can cobble together the votes. And I'm actually happy about that, and I'll tell you why. Because as doctors take an Hippocratic oath to do no harm to their patients, if we just don't pass anything, that will do no more harm to the American public.
But here's the concern of some. Let's presume, for argument's sake, the Senate doesn't pass Trumpcare, as we call it. The Affordable Care Act exchanges are struggling because of the uncertainty.
They're struggling, Brad, only because the Secretary of Health, Price, and President Trump want to sabotage the Affordable Care Act. They're telling lies about that it's imploding, that it's failing. That's not true.
But how do we...
That's not true. More people have been enrolling in the Affordable Care Act or enrolling in health care plans every year, and that's because of the cost-sharing subsidies. What they're playing around with is the cost-sharing subsidies.
But
they're making the insurance companies question or doubt whether or not those cost-sharing subsidies will continue, and that's causing instability in our health markets, our healthcare markets. And that's the reason why insurance companies themselves have stated that they're pulling out. They wouldn't be pulling out if they weren't uncertain about the future of these cost-sharing subsidies. The risk corridors that were defunded by 80% because of Senator Marco Rubio's insertion of a provision which took away risk corridors. What are risk corridors? Risk corridors were the way in which the federal government helped insurance companies in the first few years of Obamacare implementation because they knew that the riskiest, the unhealthiest people who couldn't get insurance for the longest time were going to sign up first. That was going to pose a huge risk to the insurance companies. So the government said, we know that's going to happen. So what we propose to do is to help you get through these first few years until we can ramp up the number of people signing up. And more people have been signing up for health insurance over the past few years, diluting that early risk to insurance companies, and the federal government's ability to help those insurance companies initially has been cut back, sabotaged by people like Marco Rubio and the Republicans. So look, Obamacare, if it were allowed to work and continue, and by the way, Donald Trump was going to cut the marketing to remind people just before the deadline to sign up for insurance was going to expire. To sign up, we know that many people wait till the last minute.
But let's
this is all they're sabotaging. They're sabotaging the healthcare market. So this is not true that the Affordable Care Act is failing of its own accord. It is being undermined by deliberate actions by this Secretary of Health and the President.
So let's presume that Trumpcare does not pass the Senate. We still have the Affordable Care Act in place. We have the sabotage that you're describing. Then what? I mean, they're not enforcing the individual mandate. They're spooking the markets. What happens then? We have an administration not enforcing the law that's still in place.
Well, we still have expanded Medicaid, and that's tremendously important to 40% of Californians. We have to really have the American people rally around the cost-sharing subsidies and the tax credits to make sure, and you know who's affected, I think, most greatly by these cost-sharing subsidies? They're people between the ages 50 and 64. Those people are, that segment of our population greatly benefits from the ability to buy policies with those subsidies and in the private marketplace.
When you come back, let's talk more about it because clearly healthcare is a very important issue in this region. His name is Mark Takano. He is a member of the U.S. Congress representing significant portions of Riverside County where we are today. I'm Brad Pomerance on Local Edition.